There are a lot of benefits of advanced care planning. There's so much suffering that could be alleviated with good advanced care planning, good communication about what we may want, and then following through with putting those wishes in writing. Obviously, it can improve the likelihood that you will receive the care that aligns with your values. It can really reduce symptoms of anxiety and depression. So many times I've met with people who tell me that they feel like an incredible burden or weight has been lifted once they've gotten up the nerve to kind of have these conversations with their family members and created these documents. And a lot of research is telling us that if you have lost a family member and you are bereaved or grieving, that your grief process will be much less complicated if your loved one had gone through the process of advanced care planning. So there's a lot of advantages to it. Who should have an advance directive? I'd like to suggest that we all, any person over the age of 18 should have an advance directive, not just someone who is seriously ill, because we never know when we may find ourselves in the midst of a serious medical crisis and be unable to speak for ourselves. So this is not just something for people who are of an advanced age or who have an advanced illness, something that we can all do. It could be an incredible gift that we could give to people we love. Unfortunately, this option is not available. There's no drive-through advanced care planning drive-through window. It's a little more complicated. As I've said, it is a process. It's a process of a lot of thoughtful introspection. It's a process of really educating yourself about what life-sustaining treatments are, and then a process of following through with documents and communicating and sharing those documents. So no drive-through versions available, no option to just tell your family members to take you outside and shoot you, which I've heard before, but there's problems with that plan, clearly. For one, it's illegal. Some people say, look, just unplug me, but it's not actually about unplugging a machine. So we'll go into a little more detail about what this whole process can look like. Before we go to the documents, as I've been saying, first we need to spend that time thinking about what's important to us, should our health change, and really understanding what life-sustaining treatments might be offered to you and what they might mean and how they might impact your quality of life. The first step, I think, is to think about what you value. These are some of the questions or thoughts that you might explore. Do you particularly value your ability to communicate with your loved ones? Is it your value to live life as long as possible, no matter what the impact it might have on your quality of life? You want those days regardless. Maybe you value so much your ability to sing or write or read or to walk, to ambulate. Maybe what's most important to you is your ability to eat and taste. Being free from pain is a big one. So many people share with me that pain is such a factor in a poor quality of life toward the end of life. Also, with regard to maintaining dignity, so many people also say, hey, when I'm no longer able to care for myself, to wipe my own bottom, then I really want to explore declining any additional medical interventions. So take some time, think about what you value. Another way to think about it, there are a couple of questions that you could ask yourself. One question to ask yourself might be, are there circumstances that you consider to be worse than death? Or what abilities are so critical to you that you can't imagine living without them? Dr. Atul Gawande wrote a wonderful book called Being Mortal, and in this book, he explores this topic, and he has come up with this question to ask yourself. He suggests that you ask, what trade-offs are you willing to make and not to make to try to stop what's happening to you? And in this book, he gives the example of a man who was facing a serious illness, had an advanced cancer, I believe. And this gentleman decided that The things that he were not willing to give up were being able to watch football or sports on television in his favorite chair, eating chocolate ice cream. So he was able to very clearly identify what a good life looked like to him and what he wasn't willing to trade on. I like to tell the story of my mom, who used to say that when she was no longer able to drive herself across the causeway, then she wasn't going to want, any more intervention. She loved to go to the city. She loved New Orleans, to go and have lunch and go to shows. And then she realized there was Uber and Lyft. So she didn't have to be able to drive. She could get there on her own. And so that plan went off the table. Now she says, if she gets to the point where she can't take care of herself, if she's struggling to identify who we are, put her in a nursing home, bring her chocolate, wine, and cigarettes. We understood the chocolate and the wine, but I said, Mom, you haven't smoked in 40 years. But that is her plan. That is what she has communicated to us. So some people have already really given this a lot of thought, and I'm fortunate and grateful that I'm able to have these conversations with my mom. Some of your concerns might be some of the things you might want to talk about with your family members. Hey, I really, really, really don't want to be in a lot of pain, or I'm really concerned about losing my ability to think or to communicate. So many people talk about not wanting to be a burden to their loved ones. Increasingly, people are hit by the financial burden of illness, increasing out-of-pocket costs with insurance and expensive interventions that are being offered to you. And so many people tell me about how they don't want to be a burden, an emotional burden on their loved ones. A lot of people, I've had a number of people say, hey, I really am worried that they're going to pull, quote unquote, pull that plug too soon. And of course, also the concern that they may be left on life support for too long. A lot of people talk about really being concerned about leaving their loved ones. And of course, some people are even concerned about leaving their beloved pets. So these are some of the things to start identifying for yourself. Then once you have done a lot of this thinking and contemplation, maybe even spoken with someone from your church or religious community, faith community, you may be able now to start identifying what's important to you, what your concerns are, so that we can put them in place and really honor them. Also, give some thought to those days or weeks before your death. What would be important to you? Many people imagine that they would want to see a lot of their family and friends and have a chance to say goodbye and maybe reminisce. A lot of people say they want to have one last trip with their family, or they want to be able to go see their childhood home, something like this. Many, many people are interested in looking at their relationships and maybe even making amends, repairing relationships where that might be necessary. I saw a lot of this really beautiful work being done back when I was working in AIDS, and was really excited to be a part of these relationships that were previously fraught with perhaps a lot of conflict, a lot of guilt, a lot of stigma associated with AIDS, obviously, and the struggles that families were having. And to see that repair work, those relationships being rebuilt, and that love reconnecting is really, really an awesome thing to be a part of. Also, a lot of people are interested in the idea of doing a legacy project. There are a lot of wonderful legacy projects that you could be involved in. And for many people, it's very helpful because they can know that there's going to be a way that they're remembered, either through a memory book or a recipe book, a video. So to have an opportunity to do that could be important to someone. As you get closer to the end of your life, what would having a good day look like? What does a good death mean to you? And if possible, where would you like to be at the time of your death? Most of us say that our preference would be to die at home. I think the vast majority of people, in fact, say that they want to die at home, and yet the majority of people die in a hospital or in another kind of healthcare facility. So identifying what your preference is and communicating that to your family members and to your healthcare providers can go a long way in having that wish honored. What kind of environment would you prefer? Would you like someone to be with you? Who would you like to be with you? Or would you prefer to be alone? Now that we've done all of that thinking and gone through those processes of identifying values and concerns about quality of life, we can move to the documents. The first document is a living will. What I want you to understand about a living will is that it goes into effect only when you are not able to make your own medical decisions. Most living wills have this terminology in them. If at any time I should have an incurable disease or injury, disease, or illness, or be in a continual, profound comatose state with no reasonable chance of recovery, certified to be in a terminal and irreversible condition by 2 physicians who have personally examined me, one of whom shall be my attending physician, and the physicians have determined that my death will occur whether or not life-sustaining procedures are utilized, and where the application of life-sustaining procedures would only serve to prolong the dying process, I direct the following. And then you will plug in whether you would want these life-sustaining procedures, CPR, breathing machines, artificial hydration, or nutrition. A living will is not dealing with your property. So sometimes that gets a little bit confused. If you want to designate who would inherit, your monies and your property and your assets, and that's a different document that you need to create with an attorney. A living will deals just with health decisions and does not even need an attorney involved, or even, in fact, to be notarized, but it does need to be signed by 2 witnesses, neither of whom are your relatives and neither of whom are involved in your care. And another important thing about the living will is that if you call 911 and EMS providers respond, a living will is not honored. If they see that you are in need of CPR, they will provide it. They will stabilize you, bring you to the emergency room, and you may or may not end up intubated and on a respirator. So know that a living will doesn't go into play when you call 911. There is a document that's called a La Poste, and we'll talk about that in a minute. So, as I mentioned, the living will outline what's life-sustaining treatments that you may want under the condition that we talked about. Here they are in the broad categories. The life-sustaining treatments can involve breathing support, artificial hydration, artificial nutrition, CPR, or dialysis. And we'll look at each one in a little more detail. And let's go from the bottom up. With regard to breathing support, the lowest level of intervention might be the high flow oxygen with the nasal tubes, the nasal cannulas that you see often people who have portable oxygen are getting some help with breathing by these machines. And you may or may not know of people who use a BiPAP or CPAP machine. These are medical interventions to help with breathing support. And I think that most people would say, hey, these things won't impact my quality of life too much. But then you get into the more invasive breathing support interventions, the intubations, ventilations. Sometimes they're temporary, short term. Sometimes they're long term. Just to throw in a little humor here, this couple, this gentleman tells his wife that he never wants to live in a vegetative state dependent on machines, and if that happens, to unplug him. And she had an interpretation of that. She unplugged him for sure. Artificial nutrition and hydration. So other life-sustaining treatments that could be available to you. You may have heard about TPN or feeding tubes called G tubes or J tubes, or even NG tubes. what's important, I think, to remember about these, sometimes we find it very difficult when we see a person a loved one who may be in their last days or weeks of life, and we want them to eat, we want to feed them, we want to offer them delicious food so they're not hungry and they're not thirsty. But many times people who are in the last days or weeks of their lives aren't feeling hungry or thirsty. Their organs may be beginning to shut down. And so the idea of forcing them to have food or water could actually create more of a problem. It could make your loved one quite uncomfortable. We all have heard about CPR. So CPR is when a person's heart or lungs stops working and a healthcare team or the guy on the street will run up to you and perform CPR and try to bring you back to life. There will probably be a lot of pushing on your chest in order to get the heart restarted. They'll probably do mouth to mouth or some kind of breathing bag or mask to force the air into your lungs. Sometimes CPR is successful in starting back your heart or lung, but there's very often permanent injury, maybe brain damage to the kidneys. It could leave you in a coma. And the hard reality is, the kicker is that it's really not like on TV when it seems to work so often and suddenly people are back with us and life is wonderful. Most people do not survive a CPR attempt. CPR attempts can be really forceful and loud and brutal and frantic and not result in the outcome that we want. Here's some statistics. Your chances of surviving CPR outside of the hospital is about 15%. So if you're outside of the hospital and CPR is attempted, you have about a 15% chance of surviving through that crisis. If you're in a hospital, you have a 45% chance of surviving your CPR procedure, a 15% chance to leave the hospital, and a 5% chance that you're left in a vegetative state. And those odds go down even further if you're elderly and frail and have a serious illness. So there are obviously situations where you would definitely want CPR performed on you, but I think you'd probably agree with me that there are situations when you would not. Well, so what are your thoughts? What are your preferences about these life-sustaining treatments that we've been talking about? Well, it's all kind of hypothetical right now, I know. I think one of the most important things to do is to next time you go to your healthcare provider for your annual visit, or even to make a special appointment to sit down with your primary care provider or your specialist or your mid-level nurse practitioner, physician's assistant, and start having these conversations, even without being sick at the time or having a serious illness. Hey, I've been thinking about these difficult topics of what I might want my end of life to look like. And I want to ask you these questions about life-sustaining treatments. And I want to ask you to explain further to me what artificial hydration and nutrition might look like. Have these conversations with your healthcare providers to help you when it's time to start putting things in writing. I want to take a minute to let you know that a palliative care provider could be a wonderful person to have these conversations with. There's a lot of confusion about this field of medicine. Palliative care is an approach to care that really takes into consideration what you have identified to be important to you, what you want in terms of your quality of life. They're focusing on managing symptoms, on pain management, and on helping you make decisions all along the way. In the event that you do have a serious illness, palliative care might be a great, great option for you. St. Tammany Health System has both inpatient and outpatient palliative care now. Palliative care can work alongside your cardiologist or your oncologist or your pulmonologist to make sure that as you're going through your treatment, that your symptoms are managed and that you're having the information that you need to make the best decisions along. Early palliative care, as you see on the slide, can deliver much better patient outcomes. patients who do engage with a palliative care provider have much less depression, have actually an increased survival rates, and hospital admissions, emergency room, and ICU uses are reduced with palliative care. So if you have a palliative care provider, this is the ideal person to go and have some of these, ask these questions about your disease, your prognosis, and what impact different life-sustaining treatments might have on your health and your quality of life. So the next document is the medical power of attorney. This is also an advance directive, and it names someone to make decisions for you if you're unable to speak for yourself. And I think, first of all, it's important to avoid the assumption that the best person for this role is your spouse or your adult child, because that is not always the case. Sometimes this person may be struggling with the emotional impact of your illness and may not really be in a position to focus well on the important decisions that are going to need to be made. So it should be someone who's willing to speak on your behalf and someone who's willing to act according to your wishes, even if they are in contradiction to their own wishes for you. It needs to be someone who can be there for you when you need them. So even if you think that, Uncle Harry would be an ideal person, if Uncle Harry lives across the country and has a very, very demanding job, Uncle Harry may not really be able to give you the time and attention that you might need in this situation of a medical crisis. Someone that understands what's important to you. So you've had these conversations with them, they've read your documents, and they're willing to go in there and ask important questions of the providers and make important decisions, not just about what treatments you might need, but also medications, decisions about whether or not you should be moved to a skilled nursing facility or long-term care facility. Decisions like this will all be in the hands of your medical power of attorney, sometimes called your healthcare proxy. It also needs to be a person who can handle that conflict that may be there among your family members and friends and medical providers. I also want to mention this document that I alluded to earlier. It's called the LaPoste, the Louisiana Physician's Order for Scope of Treatment. I would say that it's not actually an advance directive. It is specifically a doctor's order that outlines your wishes. As the slide says, it translates your wishes and goals of care into a physician's order that's readily available to any healthcare provider that may be involved in your care. So the LaPoste is a piece of very shiny, bright gold paper, and it is an important document not necessarily if you're not sick yet. I wouldn't recommend if you're perfectly healthy that you go out and get a LaPoste. But for someone who does have a life-threatening illness, an illness that may well end in their death, or then under those circumstances, it would probably be very helpful to have this document. And it does need to be signed by your doctor. And it very specifically outlines what medical interventions that you would and would not want in the event that you're unable to communicate them yourself. And what's great about the LaPoste is that if you call 911 and the EMS personnel are made aware of the document, then they are obligated to follow what's written in the order, which might well be a DNR. So they would not be doing resuscitation, CPR. Hope that makes sense. Well, this is my last slide, I think. What next? Obviously, you've gone through all this, you've got your documents, you've signed them, you've gotten your witnesses to sign them. Now it's important to make sure that you give them out to the people that need them, your family members, maybe your clergy, certainly your healthcare power of attorney, and definitely your healthcare team. You can have a copy and bring it with you when you get admitted to a hospital. You can bring your post if you have one, but certainly your living will and your power of attorney. And don't just say, here, put this in my medical record. Talk to them about it. Say, I want to make sure that you understand that I'm giving you this document to put into my record, and this is what it says, and this is who's going to be my power of attorney in the event that that comes into play. So have those conversations when you're getting admitted somewhere. Review the information from time to time. Make changes if you need to, but be sure to provide new documents if you do make changes. And finally, I'm putting in a plug to consider organ and tissue donation. And there are great organizations that can help with that. I want to leave you though with, when I was doing my research for this presentation, I came across a letter that was written by a physician to her family. This is part of her advanced care planning. And I want to share it with you because I thought it's pretty awesome. Her name is Karen Boudreau, and she's a MD, and she shared this letter with her family, but also online so that we could share it with you. She calls her letter, "Don't Panic, It's Okay, a letter to my family." And she wrote, "If you're faced with a decision that you're not ready for, it's okay. I'll try to let you know what I would want for various circumstances, but if you come to something we haven't anticipated, it's okay. And if you come to a decision point where you decide, and what you decide results in my death, it's okay. You don't need to worry that you caused my death. You haven't. I will die because of my illness or my body failing or whatever. You don't need to feel responsible. Forgiveness is not required. But if you do feel bad or responsible or guilty, first of all, don't. And second of all, you are loved and forgiven. If you're faced with a snap decision, don't panic. Choose comfort, choose home, choose less intervention, choose to be together at my side, holding my hand, singing, laughing, loving, celebrating, and carrying on. I'll keep loving you and watching you and being proud of you." I thought this was a beautiful gift that she gave her family, and I think it really speaks to the value of advanced care planning.